Well, perfect, perfect. I am so excited to welcome all of you to our Wednesday night webinar. And I am Dr. Rita McGuire. I'm the Chief Medical Officer here at Wakana. I want to welcome all of you, our guests, our business partners. If you are a guest, I would love to know who invited you. You can put that in the chat for me so that we can just continue to engage you in our other activities. We're having a huge legacy conference this weekend, so we want to make sure that you plug into that as well. Well, it is Breast Cancer Awareness Month every October, and I could not be remiss in really providing you information not only about breast cancer, but how CBD can assist with those who have been diagnosed with breast cancer, who may be going through treatment currently with breast cancer, or those who are breast cancer survivors. So again, I'm Dr. Rita McGuire. I'm the Chief Medical Officer here at Wakana. I want to welcome all of you. Some facts about breast cancer. You know, every 29 seconds, breast cancer is diagnosed around the world. Every 2 minutes in the US, breast cancer is diagnosed. In fact, it's estimated that 86.4% of people who get diagnosed with breast cancer will survive 5 or more years. Breast cancer is, with lung cancer, the leading cause of cancer death in women. You know, every year it may change, where lung cancer is the #1 cause of cancer death in women, and breast cancer may be #2, but they both pretty much run neck and neck. I will just put it out there. I'd like to know what the third cause of cancer death in women is. If you put it right there in the chat, I'm going to give a 4-pack gummy to the person that answers that question right. What is the third cause of cancer death in women? You know, #1 is either lung or breast or lung. What's #3? Let's see what you will put in that chat box. Let's see who answers that right. Erica, no, it's not uterine. Cervical cancer, no. Ovarian cancer, no. Whoever answers it right first will get a 4-pack of our, yes, Francine Smith Perkins, it's colon cancer. So I will make sure that Brenda sends you out a 4-count pack of our Power or Pure gummies. You'll just let her know which one you want. But yes, it's colorectal cancer. Another question I have for you, another pack of gummies as people are getting on the line. What is the leading cause of death in women? What is the leading cause of death in women? You can put it right there. Whoever answers correctly first will get a 4-count pack of our gummies. Heart disease, Jewel got it right. #1 is heart disease. So I'll let Brenda know that Francine and Jewel are our winners tonight. Very good. But again, tonight we're going to be talking about breast cancer, but just know that the leading cause of death overall in women is heart disease. The leading cancer death is between breast and lung in women. And million of women are diagnosed each and every year with breast cancer. Even men are diagnosed with breast cancer. We understand that the incidence of breast cancer per 100,000 cases by race is highest incidence is in white women, then followed by African American women, Asian Pacific women, Hispanic, and Native American women. So the classification of breast cancer, you may hear terms like this. You may have a loved one, a friend, a colleague. My colleague was just diagnosed last week with breast cancer. Estrogen receptor positive tumors or estrogen receptor negative tumors. You know, the difference is that the estrogen receptor negative breast cancer tumors are significantly less likely to respond to hormone therapy than the estrogen receptor positive. In fact, the estrogen receptor negative tumors tend to be more aggressive. And the reason why I brought up this classification is because I just posted on our Wellness for Life Facebook page a very interesting article where they've done studies where they've shown when women who are estrogen receptor negative are put on a plant-based diet, these estrogen receptor negative tumors become more sensitive to chemotherapy and treatment options. So they turn into estrogen receptor positive tumors. So it's just very interesting to know, again, that there are holistic alternatives when we speak about treatment modalities for breast cancer. So what are some of the risk factors? These are actually risk factors that you really can't change. You know, you can't change that you get older, and that's one of the risk factors. Women of older age, women who started their periods early and started menopause late. Well, why is that a risk factor? Well, when you start your period early and you stop your period later in age, you have a higher exposure to hormones, estrogen, for a longer period of time. That increases your risk of breast cancer. Women who have a first degree relative on the mother's side have an increased risk factor for breast cancer. Women who have genetic predispositions, the BRCA1 and BRCA2 genes. Women who are from an Ashkenazi Jewish heritage. Women who have received radiation therapy to the breast or chest during childhood or early adulthood. And then women who took DES. DES is a hormone that we gave women in the 40s up into the 70s who had recurrent miscarriages. So if you took that drug or if your mom took that drug while you were in utero, that increases your risk factors for breast cancer. Now, these are risk factors you can change. You know, I'm a big advocate for fitness, right? So not being physically active is something that you can change in your life so you can reduce your risk of breast cancer. Being overweight or obese after menopause is something that you can change to reduce your risk for breast cancer. We have a whole weight loss Facebook page here at Wakana. Taking hormones, hormone replacement therapy. You know, hormone replacement therapy was something when I was coming out of residency in OB that we would give you as soon as you hit 50. Now we know so much about hormones being a big risk factor for causing breast cancer. So having options, reproductive history, having your first pregnancy after the age of 30, not breastfeeding, or never having a full-term pregnancy can increase your risk of breast cancer. And alcohol. I can't say enough about limiting or even omitting alcohol. Alcohol is not only a neurotoxic, you know, that's the reason why I don't drink alcohol. Very, very, very rarely do I drink alcohol because I want to preserve my brain cells, right? I want to be not only active and vibrant, but I want to have those brain cells to keep my cognitive function really, really bright and straight. So drinking alcohol is another risk factor for also breast cancer. Again, prevention, plant-based diet. You know, foods that contain sulfurans, I can't say that word, right? Vegetables like broccoli, kale, cauliflower. How do you pronounce it again?
Cruciferous. Cruciferous.
Cruciferous vegetables. Thank you so much. Cruciferous vegetables are vegetables like broccoli, kale, collard greens, cabbage, mustard greens, cauliflower, turnips. These are all good vegetables that reduce your risk of breast cancer. Polyphenols. Polyphenols are found in foods like green tea. I love green tea. Blackberries, strawberries, dark chocolate. Incorporating healthy fats like avocado oils. You know, fruit is high in sugar. You got to be very cautious of certain fruits, but they're full of fiber and antioxidants. You know, your apples, your grapefruits, and whole grains. These are all things that you can help to prevent or reduce the risk of breast cancer. Just your diet, becoming active. Now, foods to avoid, we've heard about soy. Soy contains phytoestrogens. Phytoestrogens increase your risk of breast cancer. They increase your risk of cervical cancer, PCOS, and other hormone imbalances. You want to stay away from soy. Vegetable oil, like canola oil, they contain dangerous preservatives like BHA and BHT to preserve their shelf life. You want to stay away again from fruit juice. They contain high sugar levels. You know, cancer cells love sugar, right? You want to stay away from sugar. And processed meat like bacon, ham, lunch meat, all those deli meats. Those are foods and others that I could list probably to avoid. Well, let's talk about cannabis. Let's talk about CBD. Let's talk about its relationship in assisting those who have breast cancer. So cannabis is the family, and the family has two species. One is marijuana. That's the one that gets you high, right? And then there's hemp. Hemp is the species of the cannabis plant that gets you healthy. Hemp is healthy, marijuana gets you high. Now, the difference between the two species is the amount of cannabinoids or compounds that are found in high levels. See, in marijuana, you find high levels of THC. That's a compound that gets you high. It has very low levels of CBD, whereas in hemp, you have very trace amounts of THC, 0.3% or less, and high levels, 20% or more of CBD. So tonight we're going to talk about cannabis, but specifically we're going to talk about and concentrate on the hemp species. That's a species that gives you the health without the high. So let's look at the other compounds that the hemp species make. We talk about CBD, we talk about THC. But when you look at this wheel, it's very interesting, right? CBD is that compound that has more medicinal benefits than any of the other cannabinoids that the plant makes. And let's specifically look at CBD and its medicinal properties as it relates to breast cancer or symptoms that can be assisted in those who have breast cancer. And the number one is CBD has been found in research that it inhibits cancer cell growth. It also is a neuroprotectant. And why that's important in breast cancer is because breast cancer treatment is typically chemotherapy, radiation, and surgery. And all of those treatment modalities can damage nerve cells. So it's a protectant of nerves. It also helps to promote bone growth. Again, chemotherapy, radiation can cause an acceleration of bone breakdown and osteoporosis. It also helps to reduce inflammation. When we talk about cancer cells and its growth and its metastasis, we see a lot of inflammation in those cells. It also reduces nausea and vomiting. That's one of the symptoms that many treatments for breast cancer gives you, right? The chemotherapy, lots of nausea and vomiting. It also helps to relieve pain. When cancer cells start to metastasize specifically to the bone, it causes a lot of pain. It also causes pain from the treatment. You know, it's something called neuropathy, which we'll talk about. Neuropathy can be caused by the cancer growing on nerves and causing pains, or neuropathy can be caused by chemotherapy and radiation. It also helps to be a vasorelaxant. We see a lot of heart disease that occurs in treatments when one has breast cancer, the radiation, as well as it is very relaxing. CBD helps with anxiety. The other cannabinoids, you can see like CBDA, also inhibits cancer cell growth. The other cannabinoids are very important, like CBC, not only in inhibiting cancer cell growth, but reducing inflammation. So all of these cannabinoids are important, but CBD is truly the hero when we talk about symptoms in assisting symptoms in those who have breast cancer. So again, CBD is non-psychoactive. It does not give you the high. The THC is the compound that's psychoactive. But when you talk about CBD and THC that's extracted from the hemp species, the amount of THC is so minimal that it does not have that high that you would get from marijuana. In fact, we know that when you combine THC and CBD together, it's much more effective than just taking an isolate, just CBD alone. Also, there are people who consume too much THC intentionally. They'll smoke too much or consume too much marijuana, and they absolutely like to use CBD to antagonize or to block that high. That's just a little nugget for you. Now, the science behind how CBD works, and what I want you to concentrate on is this pathway here. This is a lot of science, and I know that you may not understand this science in the technical sense, but I'm going to break it down really easily. The way CBD works in our body is through the endocannabinoid system. And this system we all have. Every vertebrae has this system. And this system is made up of hundreds and thousands of receptors. And you can see these receptors in their pathways and how they produce and modulate balance in our body. And one of the pathways you see here is an anti-proliferative, anti-cancer pathway. And you can see CBD is the main component of the cannabis plant that helps to reduce cancer cells in our body. So this is just a schematic of the science behind how CBD works and all of the different pathways. When we talk about someone who's just diagnosed with cancer, you know, they have a lot of anxiety and depression. You can see CBD here. It may be small to you, but it's the antipsychotic, anti-anxiolytic pathways to reduce anxiety and depression. So there's true science behind how CBD works. It's not a magical potion. It's not a snake oil. And this science was discovered in the early 1990s, and it's fascinating. You know, this system plays a role in our entire body. It's one of the main regulatory, physiological, biological processes that regulates and modulates our appetite, our digestion, our metabolism, our cardiovascular function, inflammation, pain, our immune function, our energy balance, our thermogenesis, our memory, our neural development, our synaptic plasticity movement. You know, that's really important in people who have Parkinson's disease. It regulates stress and mood and even our sleep-wake cycle. So this endocannabinoid system is how CBD works, and CBD absolutely has a pathway specifically in reducing cancer cells. So let's look even further on how CBD can assist with those who have breast cancer. You know, there's a lot of studies, and you can email me if you really want to see these studies, but just know that there have been studies that show that folks who use cannabis in one study had a 45% lower risk of developing bladder cancer. So this research, now that CBD extracted from the hemp plant in the 2018 Farm Bill is now legal, you're going to see more and more studies surfacing as it relates to CBD in cancer prevention and treatment. And again, when we look at CBD and breast cancer, there is significant studies that show that using CBD really helps men and women with the side effects of chemotherapy. Those side effects, again, being neuropathic pain, nausea, vomiting, insomnia, and stress. There's significant studies that show that 74% of cancer patients are interested in learning more about how CBD can help. And this is how you can help those loved ones that you know have been diagnosed with cancer or maybe going through treatment. You can let them know that there is something that they can use to assist with the side effects of the treatment and can assist with all of the other symptoms that those who have breast cancer deal with. So again, appetite stimulation. That's another big thing that CBD can assist with. You know, those who are getting chemotherapy sometimes lose a lot of weight because of nausea and vomiting. And I'm just slowing down because I'm thinking hair loss too. We have an amazing product that can assist after their treatment, after chemotherapy is out of their system. They can even start using a CBD product that assists with hair loss, alopecia, pain relief, the nausea. Again, the studies show that these can be very, very helpful. We can never say that CBD can treat breast cancer, but what we can say that the studies are out there right now that are showing that CBD can inhibit the metastasis, the growth. This study here shows that CBD in molecular cancer therapeutics, that CBD actually induces programmed cell death in breast cancer cells, just like our own body does it naturally. So just fascinating data that you can find just by using your Google. Now, this is really big. Neuropathic pain in cancer patients. This is the worst pain that you can have. That is tingling, numbness that cancer patients have. About 75%, up to 75% of patients who have received chemotherapy can have a neuropathic induced chemotherapy neuropathy, and we can help them. We have products that we're going to talk about that can help this neuropathic pain, and the way it does it again is through the endocannabinoid system, through these receptors that were found throughout our entire body, those CB1 receptors, CB2 receptors, you know, that very complicated chart I showed you. Well, the science is there where these receptors, when CBD is consumed, they can bind to these receptors and reduce the inflammation and pain in the nerves. So let's talk now about specifically some of our products here at Wakana that you can help and assist and recommend to your family, your friends, anyone that you know that may be a breast cancer survivor or someone who was just diagnosed like my colleague last week, or someone who is currently going through chemotherapy or radiation treatment, or even have had a double mastectomy. The FDA does not approve of any of these statements. If you're pregnant, nursing, if you're under a physician's care, please consult with your physician first. We have an amazing product called Hempranium MD, which is a tincture. It's a oil you put underneath your tongue. And why I say it's amazing is because it's our most potent product. It's about 750 milligrams of CBD in a 15 ml bottle. It is an organic product. All of our products are organically grown. All of our products are tested, third-party tested, and all of our products we provide certificates of analysis. And that's critical in this market, in this industry, knowing that what's in the bottle is safe and effective. You know, when you give someone who has cancer, someone who's immunocompromised, a product that may have heavy metals or toxins or pesticides or mold, that could make that person very, very sick. So you want to ensure that you're using the highest quality products, products that are tested. What kind of products are the products you can trust? So when you start CBD, when you're recommending CBD to someone who may have side effects to therapy that they may be going through, nausea, vomiting, insomnia, anxiety, neuropathic pain, You want to start low and start slow. You want to start with 3 drops in the morning and 3 drops in the evening. You don't want that person to have a side effect from taking too much CBD too fast. Now, if they need to increase, absolutely, in 4 to 5 days, you can increase that dose to 8 drops twice a day. You can even go as high as 15 drops twice a day if you need. Amazing product. Again, organically grown cannabis sativa, along with our carrier oils of MCT and hemp seed oil. Now, our Impranium 500 milligrams, we have a proprietary formula on this particular tincture. We have enhanced our CBD in this formula with black seed, turmeric, and peppermint. You know, black seed alone by itself is an amazing product because it helps to aid in digestion. And we really need that during these times of getting chemotherapy or any other treatment. Turmeric is great for everything as well as reducing inflammation. And peppermint. Peppermint not only gives it a nice taste, but helps to relieve any digestive issues. Again, 500 milligrams of CBD is in a 15 ml bottle, and we recommend start low, start slow. 3 drops twice a day, increasing to 8 drops if needed, maximum dose 15 drops twice a day. Now, our next product, which I love, is our Power Water Soluble. We're getting it in soon. Be very patient. This is a product that you can infuse in your beverages, in your food. I love this product for those who may have some cognitive dysfunction, maybe a little dementia. You can put it in their food and water and still get great, great results without having to hold it underneath the tongue. When you hold it underneath your tongue, these other products that I spoke about earlier, it's important that you hold it for about 60 seconds, a minute before you swallow. But again, this is a great product that you don't have to hold underneath your tongue. You can infuse it in your beverages and in your food and keep it moving. Now, our culinary product is another product that you can bake or cook with. It's 500 milligrams in a 15 ml bottle. Again, this product has no added enhancement. It doesn't have that added turmeric, black seed, or peppermint, because if you're baking and cooking, you don't want those added flavors. But absolutely can be used as a tincture underneath your tongue as well. Again, start low and slow. You never want to give anyone a lot of CBD all at once, even if they have very severe symptoms. You want to let them know, I want to start you slow and low so that you don't have any side effects. 3 drops twice a day. Maximum dose is 15 drops twice a day. Our Power Gummies, again, all of these products that I've talked about thus far have the legal limit of THC, which is 0.3% or less. What that means is that if you have random drug screens, you want to take our broad spectrum products that we're going to talk about at the very end. Hopefully, if Dr. Rita remembered to put that in the slide deck. But just know that we have products for those who have random drug screens as well. Now, our gummies is something that you want to use for those who have insomnia. With the diagnosis of breast cancer, even going through treatment, insomnia sets in, right? A lot of anxiety going on, a lot of things that are racing through your head. This is a great product to take about 30 to 60 minutes before they're ready to retire at night. Each gummy here contains 25 milligrams of CBD. These are very potent because they are not coated, they're infused. So I recommend personally from a personal experience, you want to start off with half a gummy. Increase it to 1 whole gummy if you need, but just know our gummies are vegan, they're non-GMO, they're great not only for inflammation, they're great for sleep, and they're great for sex, libido. That's another thing that is affected when you are undergoing treatment for cancer, right? That libido needs to be stimulated as well. And then our topical products. Our topical products are great for that neuropathy, that neuropathic pain we talked about. That pain is very severe and extreme and absolutely can be a result of the cancer pressing on nerves. It can be a result of receiving radiation and chemotherapy that have damaged the nerve, but about 75% or more percentage of people who have cancer or are undergoing treatment for breast cancer have neuropathy. So this is a product you can use locally on areas in the hand, in the feet, wherever there's neuropathic pain. This is a product that contains 400 milligrams of CBD, along with these amazing essential oils like peppermint, spearmint, black seed, eucalyptus, sweet basil, turmeric, arnica, and clove. We have a proprietary formula even on our topical products to give optimal relief. We also have another topical product, 500 milligrams. Now, this particular product to me gives me more of a mentholy sort of cooling relaxation feel. So this is another product that is enhanced with 6 essential oils that reduce inflammation, along with 500 milligrams of CBD. Our topical relief for our Dr. Rita's rub is 200 milligrams of CBD, along with 19 essential oils that are USDA certified organic. Everything we sell is organic. This is a product that is in a oil form that can be applied locally to areas of neuropathic pain in those who are undergoing treatment or who have had treatment and now have nerve damage. And then our fast-acting products. It's always good to have a smokable, fast-acting product for acute relief. You know, that acute nausea, vomiting, or anxiety, or discomfort due to treatments. Our vape oil cartridges are in 2 sort of flavors. I love the hypnotic because I love peppermint. Anything that has peppermint, I love it. So it has a very peppermint kind of cooling taste when I vape it. You only need 1 to 3 pulls, maybe 3 times a day to get relief within 1 to 5 minutes. It's always good to have a vape oil cartridge on hand for those who are undergoing treatment or who have issues that need to be addressed in a very quick manner. And then our Diamond Life pre-roll. This is a CBD joint. It won't get you high, but it contains 106 milligrams of CBD. It is, again, a power product. All these products that I've talked about thus far contain the legal limit of THC, which is 0.3% or less. I love this product because you may have a person, and we see it all the time, that has been diagnosed with cancer but is still smoking cigarettes. This is a great product to help to cut that craving, that desire for nicotine, and offer acute relief within 1 to 5 minutes. You don't need to smoke the entire pre-roll. 1 to 3 pulls at a time, maybe 3 times a day, is all you need. No one needs 106 milligrams of CBD all at one time, okay? More is not better when it comes to CBD. We also offer a premium flower. The flower strain that we offer is an Electra. It is a sativa strain. It is a herbal, piney, peppery sort of a flavor. It's amazing because it gives you focus. It will make you relaxed. It's a great, great product for those who like to roll their own CBD flower. And again, containing the legal limit of THC, which is 0.3% or less. We also have essential oils. We have black seed, eucalyptus, peppermint, and tea tree. At this time, I want to bring up Dr. Betty, and she wants to just share with you how our amazing USDA certified organic essential oils can also be of assistance to those who are undergoing treatment, who have been diagnosed with breast cancer, or breast cancer survivors. Are you out there, Dr. Betty? Let's see if we can unmute you.
Go. Here we go. I am here.
There you go.
Good evening, everybody. Thanks, Dr. Rita, for including me in this presentation. And so I would just like to go over some of our essential oils. Now, essential oils have been shown to possess cancer targeting activity, and they've also been shown to increase the efficacy or the effectiveness of some of the most commonly used chemotherapy treatments. Our essential oils are double certified organic and third party verified. We have the certificates of analysis for all of our products. So the first one I'm going to just briefly talk about is eucalyptus. And there have been many, many studies related to essential oils and cancer and breast cancer more specifically. I think Dr. Rita may have mentioned that there are over 22,000 peer-reviewed articles on CBD, and there are many, many, many more such articles related to CBD, related to essential oils. So eucalyptus has, according to some studies, been found to be very effective in attacking breast cancer cells. And it's also been linked to the cytotoxic and anti-cancerous properties. So cytotoxic means that it kills the actual cell, the actual cancer cells. Then we have our black seed oil with the active principle being thymoquinone, which has been found to induce apoptosis, which is actually to kill the cell in the breast cancer cells. And it's a great, also a great preventive, has great preventive functions in terms of breast cancer. And it's also been found to be great in terms of treatment of breast cancer by modulating the cell's signaling pathways. Then we have our peppermint, which is great in terms of the nausea that is associated with chemotherapy and nausea, and radiation. And it also has some benefits in terms of the neuropathic pain that Dr. Rita talked about. Our tea tree oil. Now, tea tree oil is, it is recommended that it not be taken internally. One of the reasons is that it has phytoestrogenic properties. So it's not recommended to be taken internally, especially for people that have hormone sensitive cancers, which many breast cancers are. According to PubMed, tea tree also has anti-tumoral activity on breast cancer cells, and it decreases the cell viability as well as the ability of the cell to proliferate or to spread. Some of the ways that these essential oils can be utilized for women who have breast cancer. Excuse me, my cat moved. That are undergoing treatment for breast cancer. Number one would be to discuss the use of essential oils with your treating physician, because there are times when, depending on the type of chemo and the type of treatment that is being received, it is they may not want you to utilize some of the various essential oils and that kind of thing. So it's always best to discuss your plans with your treating physician. So all of these oils can be used topically, and they can also be diffused And they can also be added to lotions or potions, as I call it, to apply to the skin. I don't want to get into specifics, but I did just want to let you know that many of these products can benefit you. There are, as Dr. Rita stated, many, many articles that you can Google to find out more about them. You can also contact her and get more information. You can contact me as well. And I'm going to leave it at that.
Thank you so much.
Rita.
Thank you so much, Dr. Betty. You know, who would have thought that essential oils had a place in cancer treatment or assisting with cancer patients, assisting with symptoms of treatment modality. So that was really, really eye-opening for me, and that's why I called the expert you as it relates to essential oils. So we have, again, amazing essential oils. I want to show you one other thing here. Let me share my screen again. So again, here are our line of essential oils. Thank you, Dr. Betty, for explaining that. And then we're going to move on to Dominique Jackson. Dominique Jackson is a Wakanapreneur. She's my business partner here. And I want her to just explain what's going on this weekend. You know, our Legacy Conference is this weekend. And she is actually having an event, a legacy event in honor of her mom, which is Sunday. And I just thought it was so appropriate that we were speaking about breast cancer tonight, that you also get information about this event that is this Sunday. Dominique Jackson, are you out there?
All right, thank you. Thank you for including me on tonight's discussion. I really appreciate it. I was sitting here and I was getting a little overwhelmed because of the whole breast cancer thing, but I lost my mom a couple years ago due to breast cancer, and we were very close. She was like my best friend. I had friends who just loved our relationship, who was like, oh my gosh, I want your mom to be my mom. We just had an awesome relationship. We would talk all day, every day at work, on her way over to my home, on my way over there, talk until we entered the door of each other's home. So we talked all the time. She was my rock. I help with everything, my go-to. I know she don't have license or certificates for certain things. Besides being a cosmetologist, of course, I had to find someone to do my hair because she's done my hair my whole life. But outside of that, she was just my go-to for everything. So I wish I knew when maybe CBD and cannabis was legal and more of a resource as it is today. As I'm sitting here listening to Dr. Rita give all this information, I was kind of a little sad, but my sister and I, you know, we love her very much, and we just kind of wanted to create an organization, basically in her honor, named after her, Sheila Marie Jackson, Legacy of Love. And basically we wanted to do this, and our mission is to turn our devastating loss into an impactful and everlasting legacy of love, because that's what she gave in everything. If anyone knew my mom, she touched them in a way that they will not forget, and they speak on it to this day. She just was very loving, very caring, always the go-to person, always available whenever needed. So again, we just wanted to turn this into impactful and everlasting legacy by encouraging, you know, physical, mental, spiritual, emotional healing through the education and the resources and relationships. So as Dr. Rita said, we are hosting an event this Sunday, October 18th which is a virtual house party, as you can see on there. It's a fundraiser in honor of breast cancer awareness. We'll be making a donation to the American Cancer Society. We also plan, she was real big on education, so we also plan to, give little small scholarships to maybe students at high school that she went to, or things of that sort. But so we raise money to just, again, host those events, and again, just for the education of this. And so there'll be fun, there'll be music, there'll be raffles that we host. The tickets are $12. You can purchase them through Eventbrite, as you see here. If you look up More Than a Woman Fundraiser Event 2020. So if anyone would like to support, just search that in Eventbrite, and I can place it in the chat as well if you guys would like. But again, I thank you, Dr. Rita. I thank you all for listening, and I'm just glad that I was able to share that with you all in her honor.
Oh, thank you so much. Thank you so much. We appreciate you, and we want to support you. And I'm excited because I'll be speaking at the event. We will, educate the guest about not only breast cancer, but alternative, holistic, natural options for symptoms that we see our patients going through. So at this time, if you have questions, you can put them in the chat. We will take questions for about 5 minutes here. One question is, does it help with people who are diabetics? Yes, CBD has been shown to help with those who have diabetes, because CBD is an anti-inflammatory. So diabetes, heart disease, obesity, arthritis, all of your chronic illnesses, common denominator is inflammation. You reduce inflammation in the pancreas, you reduce those cells that having a hard time to produce insulin now are not as inflamed, you improve those blood sugars. And what I love about our Hempranium 500 milligram is that it has the black seed. That black seed has been also shown to help to rebuild the beta cells of the pancreas. So Hempranium 500 milligrams is the product I would recommend for anyone that wants assistance with symptoms due to diabetes. You can hear the way I say that, right? We are not allowed by the FDA to say things like, I recommend Hempranium 500 milligrams to cure your diabetes. We can't say that. The FDA does not allow us to use terms like cure, diagnose, mitigate, right? But what we can say is that CBD has been shown in research to help assist with symptoms that are due to diabetes, that are due to hypertension, that are due to lupus, that are due to fibromyalgia, that are due to seizure disorders, that are due to all the chronic conditions, all of the challenges one may have that are looking for a holistic, natural option to address. Our essential oils are amazing. Like Dr. Betty says, you can put them in a diffuser. You can use them topically. You can put them in a potion, a lotion. And just the peppermint, rubbing peppermint in the soles of your feet. You're talking about who needs Red Bull anymore? No one does. Natural energy. And so those are the things that we empower people with this information, that there are alternatives, there are natural, holistic alternatives to your health. And we want to get that information out. Any other questions? Does it help with the rheumatoid arthritis? And I think I just mentioned that. Any chronic illness, rheumatoid arthritis, osteoarthritis, any of the itises, sciatica, any condition that deals with a lot of inflammation in your body. CBD is an anti-inflammatory, it's an antioxidant. It helps to reduce inflammation. It helps to reduce those free radicals from tearing our body up and causing disease and cancer. Absolutely can assist with symptoms due to rheumatoid arthritis. You want to use the topical with rheumatoid arthritis. You want to use the tinctures. You want to also use the gummies at night You know, I work out every single day. My poor body is sore all the time, right? So I use the topicals at night before I go to sleep. I rub those areas that are sore down. So when I'm sleeping, I'm comfortable. I also use it pre-workout. So before I work out, I'll use the topical products. It's important to use all the products so that the CBD is in a steady state in your system. So using the tincture under the tongue twice a day, using the gummy at night, using the topical when you need it, using our smokables for acute conditions that may occur. So all of the products can be used together, but you want to go low and slow. You don't want to use 15 drops twice a day and a gummy. You know, you want to do 3 drops twice a day, a gummy at night, your topicals when you need it. You know, it's just a great synergy of products when you use them together. Yes, CBD can help balance hormones. Absolutely. There's studies that show that because of the endocannabinoid system has receptors, even in the reproductive tract, that can assist in managing symptoms that are due to menopause, perimenopause, you know, hot flashes, mood swings, all of those things. Absolutely, yes. Black seed oil and peppermint can be consumed also. Yes. Black seed is used underneath the tongue. Again, you can start with 3 drops twice a day. Our peppermint, as well as all of our essential oils, are organic. They are very potent. I put 1 drop of peppermint in my immune defense tea. That immune defense tea is off the chain. I put a drop of peppermint with some lemon. Oh my goodness. You've got to try it. It is the best tea ever, 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 ever. I can go on and on about that tea. That's one of my favorite. Yes, we didn't talk about our hair loss product, our Hempranium Hemp Powered Hair. Sorry, I didn't do that. But our Hemp Powered Hair is a product that not only has CBD, but also our latest formulation has almost 900 milligrams of CBD, as well as our essential oils that address inflammation. It addresses the hair follicle. It addresses areas of thinning. It helps to grow more volume, more luster. So it's a great product for those who have had hair loss due to chemotherapy, or maybe hair loss due to hairstyles that we may wear. As long as you have a hair follicle, the hemp powered hair works. And not everyone that gets chemotherapy has permanent hair loss. I have 3 friends that have, the 4th one was just diagnosed last week, unfortunately, but 3 friends that have undergone chemotherapy for breast cancer and their hair grew back. So it just depends on your genetic makeup and how much chemotherapy and what type. But yes, as long as you have a hair follicle, the hemp powered hair will absolutely help to renew that hair after chemotherapy treatments. Alopecia, right. When we tell people these products will put their body in balance, what does that mean? That just means that when your body is out of balance, you have pain. When your body is out of balance, you're stressed out. When your body is out of balance, you can't sleep. That's what out of balance means. Balance means you sleep at night. Balance means you're relaxed and not stressed out. Balance means you are less anxious. That's what balance means. Balance means that you're maybe you have Crohn's disease, and maybe you have flares of Crohn's, 4 flares every month. Balance means that now, instead of 4 flares every month, you know, this has reduced you to 1 flare a month. So that's what balance means. Put the body back where it should normally be, without pain, without anxiety, without sleepless nights. Great question. Rice water helps with hair growth, especially black rice water. Well, thank you for that. That's a statement. I've learned something new. I don't know anything about rice water, but thank you so much. Any other questions? Well, this has been very, very informative. Hopefully you have a better understanding about cannabis, about the hemp species of the cannabis plant, about CBD, about our products and how they can assist. We never want to say treat, mitigate, or cure, how they can assist with symptoms due to either treatment modalities that one has gotten for breast cancer, chemotherapy, radiation, or surgery, how it can help for those who have just been newly diagnosed with their stress level, with their anxiety level, as they're going through the process of learning what treatment they're going to be offered, and just hoping that you have a better understanding about even essential oils and how they can be used as well. Is there any other comments from the Medical Advisory Board? I know Dr. Tyus Crawford is there.
Yeah, just as far as preventative, you mentioned our genetics, which is environment related, which is, you know, what you put in your body and, you know, minimizing stress. But you also want to be able to have a conversation with your provider as far as screening. Usually between the age of 40 and 50, there's a discussion. However, most Black and brown people do have a high risk. So usually you would get a mammogram baseline between 30 and 40. And then, you know, depending on what those outcomes are, you would get them yearly up until about age 80, I think, if that's the correct recommendations now. So just remember to follow up with your routine mammograms.
Right. How could an OB-GYN forget to put that slide in?
Well,
That's Rita.
And my mother is a 12-year survivor of breast
Awesome.
Awesome.
And
Self-breast examination.
yes,
Examine
yes.
your breast. Examine your breast, ladies, every month.
But don't get too anxious about it. But
Yeah.
don't get too anxious about the breast. You know, once you start feeling your own breast, and then you'll know what this lump is, that lump is. But watch that caffeine too as well.
Absolutely. Thank you, Dr. Crawford. See why I have an amazing advisory board, Wakana Medical Advisory Board. So many amazing health professionals here that really are leading the charge, really helping to educate our Wakana nation and just bring in fresh information every Wednesday. So thank you so much. I think someone wants to get that tea. It's called our Immune Defense Tea. It is amazing. Put 1 drop of peppermint in there with some lemon. Oh my gosh. I'm at work tonight, don't have my tea here, but it's really, really a great tea. So thank you, everyone. Thank you, Dominique Jackson. I'll see you Sunday. I'll see everyone else Friday night and Saturday for our Wakana Legacy Conference. Super excited about that. Thank you, Dr. Betty, and thank you, Dr.
Thank you.
Good night and good night.